in your inbox. You are.
It doesn't help. Let me get it up. I'd like to have something right on. Oh, well, Dorothy's here. I don't see it.
Okay.
I'll
October
re-energize it.
27th is when she sent that one.
I thought it was today. She's not. Jennifer. Oh, here it is.
And I'm gonna print it.
Okay.
Can't click on the link on that one.
Oh, you can't?
No,
You gotta refresh it maybe.
probably because you took away all my permissions because I was rude.
Mm-mm.
It's there. I don't know why.
What's there?
I'll go to the commissioner one. I can click in on.
Are you
that.
printing it or not?
Yes, I am.
I did a workaround.
Sweaty forehead, runny nose gone here from the chili. Thank you.
You're welcome.
Everybody ready to spin them up yet?
Ready when you are.
Run them. You ready? Is it
Yeah.
on? You
It's
got it
up.
going? Okay.
Yeah. I said that it was up.
I didn't hear you say, you said about you were getting right. All right, let's call this meeting to order. This is Bill Canada, Board of Health, Custer County Board of Health Chairman. I'll call this meeting to order on Monday, October the 31st, 2022. Meeting being recorded both by Zoom, is it Zoom too? Zoom and on the phone,
On YouTube.
YouTube, I should say. So we call it order now and let's stand for the pledge. Dorothy, you want to lead?
I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Thank you, Dorothy. Okay. Jennifer, how about the roll call?
Bill Camden,
Here.
Kevin Day,
Present.
Tom Flower,
Present.
and Jennifer Creed, secretary, and Dr. Brown.
Present.
And Dorothy is the sanitarian. And she's here.
Audience introduction. Thank you, Dorothy. Is anybody else? Is anybody online?
No one's online.
Okay, amendments to the agenda. Kevin?
Then
Tom?
No, sir.
I don't have any. And the minutes are available on September 29th. They were pretty complete. I like them. Any amendments?
nothing for me, no.
No, move to approve the minutes, September 29.
Second.
Been moved and seconded to accept the minutes from the Board of Health meeting, September 29, 2022. All in favor, say aye.
Aye.
Aye. Okay, we've got a Board of Health report. This would be from anybody here on the board. If there's any issue or something we want to bring up right now, Tom.
No, just to reaffirm, we voted to pay the improvements on your trailer.
Thank you, sir.
We assumed, based on what Brady could tell us, that most of it was for an awning.
Part of it, there was actually holes in the side, somebody had, I won't assign which department would have done so, but literally gouged out the sheet rock inside, sheet metal side by backing a trailer up into it. And there were some rust spots and so on that were damaged, but the awning literally had been blown loose, torn off the metal. So it's now reinforced and a new one put back on, so we can use it to shield people when they don't want to be standing inside. So that was done, plus the tires were replaced because all 4 of them were dry rot from sitting there.
And been used a while.
Yeah. And so that was taken care of. Also the generator inside that's kept inside to run electricity, of course. The battery, literally, if you've ever seen batteries that have been frozen and so on, this one bowed out in the center, so it was totally not functional. So that the battery was replaced and the generator is working fine. Right now, it is currently, along with the pickup, up in the Denver business that usually seems to do these things for our county. So they're putting the public health logo and so on the truck and the
It's a
trailer.
recommendation from Chris.
Yes, yes. And it is the art store up there that does it. They deliver it on Friday. So they have that, and we have things taken apart that were extraneous inside that didn't help with performing clinical functions. So that has been done. They're all torn out and everything kind of put together again. I would like to have a spraying of insulation on the inside so it seals everything from water and from heat, cool loss, and so on, for performing clinical functions. So we were finally able to get things going. So yes, that is what's happening with the training.
Since you brought up something to think about on those batteries, it's gas power.
Yes, sir.
So you need to throw in some sea foam or Stay-Bill or something in them always. Because it's sitting on stabilize that fuel. And then the other thing is to start it every couple of weeks or every month. So
Well, there was-
the battery going.
Planning on doing, we're planning to purchase for just, we're not talking about for the truck, of course, that's decent. But for the generator, buying gasoline that is not full of ethanol.
You can do that too. But you can get it from the airport. You can get the
Okay.
high test stuff that's good for them.
Okay. That's how we run
You can buy it from
our
them.
private.
They just run. Anyway, maintenance is good. 10 days.
Yeah, we have a guy who does a pretty good job on those things. But for sure.
You think, Kevin? Okay, so we'll move on to the actual report then from you all, and I guess Dorothy, unless do you have something to introduce things with? Dr.
I don't
Brown?
have,
I mean, can you make him a copy too?
Oh,
did you already, I think you already copied.
no, he was just wondering if you had a copy of the agenda. Dorothy's next.
Yeah, I know she is, but do you want to bring anything up so she can report on it, or did you just gonna have her do?
No, I think probably let Dorothy, I have things I can comment on because I
Well, that's fine. I just,
made a few trips out to. look at
it's your
numbers.
report, it's your show, and
Okay, yeah, I'd like to have Dorothy go ahead.
I had talked to Dr. Brown earlier and he asked me to come and kind of just give you guys a little update on where we're at on a couple items. I have served a cease and desist order, I believe it was Thursday of last week, on a property by the lake that is utilizing an outhouse. They're in the process of putting together 4 campsites on their private property. It's a 35-acre lead out close to the lake. I did get with Clint prior to serving that cease and desist. The owners of that property live out of Custer County. So I was able to go out there and serve the cease and desist order and
So who, they were there that day? or
they were
something?
not there.
So how did
So-
you serve it?
Well, I posted it, I guess is probably a better way to say that. So it's taped up, they cannot. And then there's a notice on each one of the doors.
Is there, Clint was fine. with
They have
that?
it, they're utilizing an outhouse out there.
Well, I understand what it is. I'm just wondering if that was adequate for Clint's, from Clint's point of view to say it's been served. And
I will be sending, they will
that something
get,
in the mail too.
they will get a certified notice in the mail as well.
Okay.
Yep, certified. So, as well as regular mail, just like we always do.
Fine.
Are there structures on that property besides the outhouse?
There's one structure that is, I believe the neighbors have reported that they believe that when the owner is in town, they're staying inside the shed.
Is
Does
it a
not
shed
come-
with a floor? Is it?
Mhm.
Is it shed with the floor? I'm sorry. I'll
Yeah,
speak up.
It's a nice, very nice shed. It's not a dirt floor, it's a cement floor. It is not connected to their septic. They do have a septic. The campground sites, they have 4 gravelled sites where you can back in. They are all connected to their septic. And they are in the process of putting electricity in.
There's no reason to have an outhouse. Why? They were using an outhouse anyway. It's kind of crazy.
I think they have it there for their use. There's not. I don't know. They can't, the septic is not connected to the shed.
Well, I get that, but
It's only connected to the 4 campsites. So unless they had something to dump into those ports, it's not connected.
Mhm.
So that's what they're utilizing. And it's being dumped out onto the ground.
Wow.
I have another one out at Lake Dewey's, in that area. That is utilizing an outhouse, and apparently, from the looks of it, it has been being used for quite some time. And never reported. So I need to get with Clint on that one. I'm in the process of working on that one as well.
Hmm.
And then-
Yeah, it's weird, Colorado passed that law that you can't use an outhouse, but you can still own an outhouse. They can still sit on your property. Fine line between having one sitting there and whether or not somebody's using it, unless you go in and look, pretty hard to tell.
This was pretty apparent that they were using it. They had a hose coming right out of the outhouse
Right.
to on the ground.
So you didn't have a pit dug under it?
No,
Really?
no, they had a bag system and
Way.
the solids and the liquids were going out on the ground.
Wow. Okay,
So the amount of rock, just subsurface, and some of it's not subsurface, of course, out there, that's pretty direct contamination, so I can't excuse them at all.
so you got a tape on it on that one too?
I have not done that yet. That is on.
You just happened to see it when you were out there on the other?
I got a call from a neighbor.
Surprised they hadn't been calling sooner. These sound like they've been there a long time.
I asked her about that and she said that she was trying to work with him. However, apparently
You tell her blowing
things
her
were
off.
going awry in their neighborly relationship and she just wanted to make sure that we knew what was going on. I did check with Jared to make sure that this gentleman was not a veteran, because she thought he may be. I don't believe that he is, because I thought maybe we could get him some help. He doesn't stay there apparently year round. He's only there during the nice months of the year and lives with his sister during the winter months. So
Up here somewhere. His sister is here.
his sister lives in a different city.
Okay, well, good.
If I may,
Go ahead.
I guess back to your first one. Cause you said they're developing 4 campsites and none of that has been permitted or anything
No, sir.
as well. Okay.
So you're working that too?
It's all tagged
So it's cease and desist on everything.
on the entire property.
So is it a cistern or is it a septic system with a infiltrator,
It's a full septic that they have out there.
with infiltrator system and all, you got a print out of it? Is it on file?
I do.
Okay,
It does not show the connections to the 4 campsites. But it does show the original.
so you don't know if there's a manifold on it or not for those 4 campsites? Do they have a place to dump it in at each? So there must be a manifold that's going together and
Yes.
putting it into the tank.
As far as I can tell, yes.
So that should have been printed up too.
I talked to the contractor that put that system in and apparently they did it. Jackie was out there and did an inspection. They did it following that.
So if there is
inspection
one,
for-
there should be one on file then, Jackie, I would think.
It doesn't show
doesn't
that in
show
the
it.
diagram.
They
Okay,
modified it without having a permit, right?
maybe they modified after the fact.
It appears that way that there wasn't
Well,
a permit to do the
I-
modification.
That was my concern, but according to the contractor, they had a verbal okay to go ahead and make that change before they covered anything at that addition. So, and it's a very,
That means it was inspectable at the time then.
but that
So who knows?
portion of it
Okay.
was not inspected according to that contractor, and it's a very well-respected contractor.
You had mentioned to me also, the mayor, the problems with the electrical hookups that they're
Yes.
putting in.
The electric that they are putting up for them campsites, in my opinion, I'm not an electrician, but what I do know is not up to code. I mean, any kind of code. I didn't realize we don't have code, but they would have to pass some kind of state electrical inspection. And it's not even,
That'd be
It's
part of the
ran in-
special use permit that they should have had, that they haven't.
the electricity is ran in a plastic pipe. It's not conduit, it's not nothing. It's just a plastic pipe with 4 wires
White,
coming out
white
of it.
pipe or gray?
White. Plastic pipe.
Anything else?
No,
More to follow, it sounds like,
Yes.
both cases.
Any structures on the second property you mentioned?
Anyway.
Home structures?
Yes, a very older, a very old structure.
Like cabin or?
Yeah. Yes. It didn't. I went out there, it does not appear to be a very good situation.
And your plans would do a cease and desist on the second one?
Just probably on the
Campsite.
outhouse itself.
Yeah, oh, yeah, that's the only one. with-
Because actually, we don't have anything to say about the electrical.
That's right. But that would be part of the permit process. They're gonna construct.
It needs to
anything.
get a permit for a septic,
It wouldn't be electrical related. Unless it's got a pump in it or something. It doesn't sound like, not above ground. Okay,
Any other questions?
not for me, anybody. Okay,
Thank you, guys.
thanks.
Thanks, Dorothy.
Thank you, Dorothy.
Thanks.
You know,
Okay, the first item on our agenda is the general information financial update. This can take a long time, or I can literally give you forms, expense budget worksheets, so on, to look at individually in your own time. So what I would like to do is just go through some of the bases that I have used for doing what I have done relative to our shop, our agency. I would like to introduce to you first, to kind of give you a basis for what's behind some of the decisions that I've made in our particular, it's not just our county, but our state right now. We have a lot. I'm not talking about a few. We have multiple agencies throughout the state that they cannot even find people to come in and take a position in public health. There's been so much negative press, I would say, public health within the last 2.5 or so years, that people are leaving the positions, not flocking to them. And so once you look at the law of supply and demand, you know what happens to salaries at those junctures. So even Michelle, I don't know, do they have the salary support? Did you send it out to them? Just says salary support at the top. And the first part of it's
I didn't see
Michelle
it.
Schumer.
Did you send it?
Yeah, it didn't upload, so I just looked again and double checked and see if it's there now.
Take a hard copy to just one sheet.
Well, his whole packet is 12 pages, so.
Yeah, I can,
I don't see it. Do you guys see it?
Be county shared, is that where you put it?
And under Board of Health.
Just shared with me, and then when
Let
I see Board of Health agenda.
me just,
yeah, that was the original agenda, and I went through and answered each of those
okay,
topics.
I'm just looking real quick. See if it actually moved, because I put it.
Okay, it's there now. If you refresh it, I just hit the circle button up there and it brought up finance assurance. Is that what it is?
Okay,
Edited today.
Yep.
And then there's, well, I don't know if that's it or not. That's
Over your airport or
That's-
landfill.
that's the other stuff. Yeah, it's not it.
it's under BOH, Board of Health. And it says BOH report.
Really. I gotta get to the BOH somehow. So I don't see it here. I'm in maybe the wrong one. It says share with me and all I have is the agenda.
I don't have Board of Health for me.
Okay, so go down, go down. Commissioners,
We gotta go down to the commissioner's office.
yeah, Board of Health folder, and then Board of Health report.
Oh, there it is. There's a Board of Health agenda template. Okay.
Did you find it, Tom?
Yeah, and Board of Health really shouldn't be under commissioners. We ought to have a separate file for
Yeah.
that. And then
Well,
go back
and-
to here.
It's just a shared file, so
Right.
those are all of the
Oh.
things that are shared between the four of us.
It's not commissioners, it's commissioner's office, so in
Correct.
here in this office.
There you call it. That's fine.
Do you want to try to scan this? Or
I've
do-
already
did
done
No, we got it.
Thought you did.
So- Dr. Brown,
Yes, sir.
what we care about, you're saying it's a financial update, is it? Or general information? Is it general information on things you're doing, or is it just a financial?
Well,
That-
it is
what do you wanna
on things
do?
we're doing Financially.
Okay, we'll make it concise and
It's okay,
we don't have to go through a
okay. I won't
litany.
go through all those things. I did make a listing for you. Some of the things that we've done. It's not a conclusive, complete list. But under changes and additions made since assuming directorship, do you guys see any of those
No.
things?
I gotta get down with what you have first in the packet is vaccination report, mammograms,
Yes.
CPA recent activities, flu clinics, it says.
And the first bullet above that is the general.
Yeah, you got
information.
that. It says see attached documents.
Right.
Where are they attached below this?
I would assume, you handed me the packet and I scanned it. So,
Okay.
Let's see how far down we gotta go.
I'm sorry.
I
got
see
this.
salary support, that kind of stuff.
Yes,
That part of it.
yes, that's,
Salary support, and then above that, salary support. Detailed information on full staffing required. So that's that where it starts?
yes, sir.
All right, so get where you want to talk.
Okay, basically, I can go through this very, very quickly. I have it's called a public health workforce calculator. And this was done nationally, and of course, it is factored down into states and then into counties, regions, states, counties. And I went through this, I submitted all of our data. And
To the state to get into the calculator, is that?
to get into the calculator,
Okay.
yes, because this was done back in Minnesota and they brought it down to, like I said, regions and states then counties.
Okay.
But that's what it says on the top. It's blue and public health workforce calculator, basic outputs. Okay.
In this case, it's just black and white.
Okay, and that's fine. Okay, but basically you can scan down through and you guys all know, gentlemen all know what FTEs are. But the point is that what they've done here is say, okay, to do the basic jobs that you're supposed to do. They break it down into foundational capabilities and into foundational areas. So the foundational capabilities in a nutshell, 13.9, that's full-time positions, okay?
Yeah, and just to make sure it's clear, then this is in a county our size, with our
Yeah, it was
population.
our specific.
And it
yes.
was in the rural
Yeah.
background and all that stuff,
Yeah.
all the right
I filled all
parameters
that
that you filled it in.
Yes, and then they came back to me with this.
Okay,
Now, I don't think we can afford to do all the things with individual people. What we have to do is, and I've done this, is to assign all of these different categories to the people that we have presently working for us. So the assessment, surveillance, and emergency preparation response, community partnerships, and so on.
Okay.
All those are broken down. And then we also have put our people to kind of update, since such a heavy concentration was spent on COVID and virtually nothing else for 2+ years. The chronic disease and injury prevention, the communicable disease, environmental, public health, maternal child. Anyway, we've broken this down, and I don't have full-time people doing any of these things exclusively. We're splitting up the joy, so to speak. So, but we do have one person who I've not introduced to you guys yet.
where do we see your personnel numbers? How many people do you have? 3,
Oh,
10,
no,
20?
no, I'm sorry. I have 3 nurses and 2 technicians who do the investigation and contacting and tracking and so on when we have an outbreak of any kind. And they are currently assumed the job from the state, because the state backed it up and said, we want you to do it, after saying, no, we demand that we do it. So now things are reversed again. So all of that is being taken care of by 2 technicians. We have one who helps with financial matters and also does answer phones and do appointments. So they're all combinations, but we put people through one of the things that I've been really concerned about, and others are also, and that's TB.
Okay, so you got 3 and 2, that's 5, and then
Yeah,
you,
and then we have one more for the financial and helping with the phones and making appointments
you have 1 finance
technician.
and technician, sort of administrative.
Yes, yes. Plus we have Rhonda for grant management and financial. It makes out all the checks and does all those things.
Is that,
And
is there more to her job than that, grant management and,
grant management and the financial
okay,
officer for the clinic.
okay,
So she goes through those things. She helps to write up the grants when I don't do it. She always contributes
Okay.
and she manages the funding. So she takes things in very detailed amounts.
okay, so then you got 5 full-time employees, and what you're doing is prioritizing the FTE spent to the categories that you're supposed to be doing,
Yes,
and
sir.
what's important to do, and some you won't do,
Yeah, so we just,
because maybe there's some that are not applicable.
yeah, and we literally catch as catch can. We do everything. We try to cover it, but we have to have multiple hats.
Okay.
Okay, so anyway, once again, what they're recommending is 14 full-time, and then foundational area is 18 plus Obviously, we're not going to do that, but just to let you guys know kind of what is demanded of us as far as performance.
Okay.
Okay, now, for the salary support, I had mentioned to you gentlemen before that nurses straight out of school in Pueblo right now, $159 an hour, and that's not even counting any experience.
That's after certified nursing degree.
That's right. That's after they get the 4-year degree.
That's a RN,
Yes,
any,
registered nurse.
not a master's degree in anything.
Nope.
Just a straight up.
It's not
RN.
straight out of school, 4 years. Okay, but there are a lot of thousands of dollars that get spent on this education.
Okay.
So it's an obligation they have, as soon as they get out, to start paying back this loan plus trying to stay alive. So because of the demand right now for registered professionals, we have a lot of competition. And so what I've tried to do is to hire people part-time so we don't have to pay them so much, but hire them in their specialty.
Okay.
And you had Peggy come in and we introduced her last week, or excuse me, 2 weeks ago, whatever it was, a month ago.
So before you get
I'm
into
sorry.
it, so of these 5 employees, how many of them are part-time?
We have 3 technicians that are part-time and 2 nurses
2 and 1 full-time.
and 1 full-time nurse.
Okay.
Yes.
The technicians and the finance guy is part-time, so there's 3 part-timers.
Yes.
Okay,
Well,
and
there
then
are
2
3, excuse me. There are 2 technicians that are part-time, and there is 1 technician that is full-time. There is 1 technician that is assistant for financial, and she comes in like 1 day a week. Along with the 2 part-time nurses who come in either 1 or 2 days a week, depending on what we need at the time.
Okay.
And then we have 1 full-time technician who kind of heads up the contact tracing and contact investigation. And we have 1 full-time nurse. And we have 1 finance grant manager,
full-time,
full-time.
so there's
And we have
3 full-time
Yeah, and
employees.
we also have Patrick, who's full-time, who works with the various services for people who are using.
Okay, so he's not listed here yet,
He's not listed there at all.
and he's called 1.
He is funded basically on grants.
I know, but I just,
Oh, I'm
what,
sorry. Yeah, I'm sorry. He is drug abuse.
okay.
He spends his time at the schools and with various counseling
Okay.
organizations.
Got it. So that's 6 employees.
Okay, questions, gentlemen, on any of this?
I'm glad to see the racket. I didn't realize it. Good.
Yeah, so they're very busy people. We have in recent activities. And I wanted to bring up this other component from Michelle Shumura and to let you know some of the things that have been changed since I came on.
Okay, where are you on your sheet now?
Now I'm still under the first one because it's general health and financial update.
Yeah.
So just to let you guys know what is happening, because I don't talk a lot about it.
That's okay. There's no supporting that. You're just gonna talk about it.
Right, I was just gonna run through a list of all the things that are at least part of them.
Okay.
That we are doing and we have done here in the last 1.5 to 2 years. I put all 3 of the nurses, the RNs, through non-communicable disease trainings and communicable disease trainings. I have assumed the position of the county rabies investigator reporter, organized with the vaccine bus, excuse me, coordinator for the state, So we've set things up and been able to provide vaccinations and shots and so on. Function on the Southern Colorado Regional Hospital Coordination Committee. Begun working as an investigator here for the lead program for the kids, the wastewater program for with Round Mountain in the school, TB, the advanced programs there, child fatality program, dental. Do you have this list? I don't need to. One of the.
I'm looking for it.
Okay, it's
Hey,
excuse me.
page 2. Okay, so scroll up that way.
Page 2.
Right, but if you look, he has some numbered pages.
Page 4.
So 1 of 2, right there's Michelle.
Oh, there it is.
So under that, it changes and additions made since assuming.
Says see attached.
Bless you.
Thank you.
Okay.
Okay. The hazard mitigation program with KC, the children's. Kind of a second, the next page. But one of the big programs that I've mentioned to you gentlemen before is the maternal child health and the initiation with this part-time nurse who has worked in that area for 20 years.
CCK guys were in here and talked about partnering with.
Yes, exactly. And we attend their meetings, Sherry and I both, and Beth Green attend their meetings routinely. By the addition of-
So you've been going to fentanyl training.
Yes, sir. We just this weekend.
Have they seen anything up here?
Yeah, I was just gonna say, just this weekend, one of the people here in the valley, his little niece got into the drug cabinet, got a hold of fentanyl.
In their drug cabinet because he's on drugs or
Not
something?
his, but this is his grandniece or great niece or whatever. Anyway, it was into her parents.
Oh, they don't live here or they do?
They part-time,
Okay.
okay? And I can't go into too.
No, I
much
understand. I'm
information.
just wondering if it was in the county.
Yes. Anyway, the child OD'd and died.
Really?
We had another baby whose mother was breastfeeding and doing everything she thought she should be doing, and she was, except that she wasn't actually producing milk, and the child died. Complications from. Anyway, this is why we need to have these programs. It's it would be totally irresponsible.
So between you and the kids council here, you want to get the intel enough to go to
That's
the
right.
right places.
Yeah.
It may be late, but you'll get there.
Well, we're establishing not a council, but meetings for the pregnant women here in the county so that they can receive training and
Prenatal care.
learn benchmarks right while they're still pregnant, and then the first 2 months after they give birth, so that we can work with them so they make sure that they have the nutritional support to keep the child alive and keep them going. A lot of these kids, when they have been around mothers who smoke or mothers who are using various types of medications, quote unquote, self-medicating, these kids are the ones who end up with real problems a little later on. And like I quoted for you last session, just the general cost to the community when something like this goes on is around $200,000. So to me, to spend 1 day a week salary to have somebody teaching these mothers and trying to cut that off at the pass before it ever begins, if we could do that, it saves our county a lot of money. Okay, so those are just a few. I actually went on a national medical program here 2 weeks ago. The 360 healthcare panelist with Dr. Schultz, and he wanted to ask questions about frontier public health and the challenges that are there. So spent about 45 minutes with him, and that should be aired here within probably the next 2 to 3 months. Tom knows relative to the opioid governance council, because he sits on there. that we're not inactive. We're accomplishing things there to get the governance set up so that we can dispense funds to the various programs that are needed. We're in the process of setting up programs for kind of supporting mental health workers who are wanting to come in here, but it's pretty expensive and they don't get paid all that much. So trying to support them financially for their housing, just to be an incentive. And Tom was in the meeting for some of those things. Are you working, Tom, now on the anti-stigma? Yes, that's what I thought. Anyway, we're divided up in that governance council into 3 separate areas. Anyway, also emergency preparedness most recently, in view of some of the happenings worldwide and how we might be affected. We would not be affected particularly by a nuclear device here, except for perhaps the radiation and the fallout. Children below, and I'm sure lots of people would take issue with me for calling them children, but anybody 20 or below, their thyroid is really susceptible to being tied up with certain portions from the radiation, that within 5 to 15 to 20 years, their thyroid develops a cancerous overgrowth of tissue cells, abnormal tissue cells. So instead of paying big bucks for very fancy masks and filters that can be changed and so on, do a little research and we can actually use our KN95. You guys help pay for it, and we've purchased more now. It's only a one-time use, so we could protect our kids for an extended period of time using the masks that we have and have already ordered. So anyway, that saves several $1,000s in masking, and the first responders can also do so. So cheap instead of expensive. But we've also ordered potassium iodide, and that is what the child can use when they've been exposed to protect their liver. Questions on any of these things? There's so much here. We're right in the middle of influenza season right now. We're chock full of people in flu clinics. Plus we're doing the regular shingles, TB, all the other things that need to be done. Plus what is held over right now for COVID, for the bivalents, people who want to have their shots there. So those are happening this Friday. We have one of our last 2 buses coming in, vaccine buses coming in from the state.
What, I have people ask what brand of COVID, Pfizer, Moderna.
We have Moderna, but the bus has all of them.
Okay,
From kids, everything that's been passed by the FDA on. So all they literally have to do is show up between 10 in the morning and 6 in the afternoon. And they can have the kids if they want them, or themselves, or their grandparents, or whoever. Yeah.
but also that is not something that you run yourself. So if something happens and the bus doesn't come, that is a state thing, not
That's
a
right. Yeah, it's
Custer
not,
County thing.
yeah, it's not that we didn't show up.
Correct.
Yeah.
I
Yeah, they had a bus breakdown one day when they were supposed to be here. The bus just gave out, they had to have it towed, so they lost that whole day. But other than that, they've actually done pretty well showing up.
I had somebody ask me this weekend on Facebook, and I told them the same thing. I said, please contact our health department and the bus. I gave them a link, and I said, because this is not through us, the only thing that you can do is look at what their schedule is.
That's right. And she keeps in pretty good contact with me. Her name is Christy.
Mhm.
And so I'm on the phone with her frequently. It's just that sometimes I have to tell her the bus is not here, you know, that kind of thing, so. We do what we can. So for emergency preparedness for fentanyl treatment, for the directors, we're doing things. If you want, also included in your packets should be our expense budget worksheet, showing what we're doing financially and also for the Custer County Public Health Agency for full-time employees. The others are not being affected by any of the changes that are recommended. So what I'm trying to do.
So just
right
so
now-
I can understand it a little bit.
Okay.
better.
What
So,
I'm-
yeah, I see the sheet. It's got salaries, it's got fringe benefits, it's got communications, child fatality. So like, this is money spent, is this income or outgo, what is it?
No, that is just the pay schedule.
Okay, so that's everything.
Yes,
And like breastfeeding, feeding, you're getting something for $3,000 worth of effort.
right.
Okay, so this is the total. Is there a total on here?
No, there's not a total. Well, there is a total.
That's okay. I mean,
Okay.
normally you would see the baseline, so that's is that what you started the year with?
We
And
have
you're-
it broken down in, on the top. It should look like this. Was that should be.
I'm just looking at expense budget worksheet, public health.
Yeah, this is just pay
2023.
rates by the month, 2022.
We don't have that.
Don't have. All we got is this, what your worksheet is.
Okay, that was one out of the three sheets.
I don't know why I didn't copy our, you
Sure.
told me put the
Yeah.
whole thing in.
Well, I see one of three here that's given funding source, vaccine, whatever that means.
Yeah, those are different. Those are income and output.
Okay, anyway,
Okay,
so are you halfway spent through the year? Yeah, you ended up with this, when did it start?
We are-
October, are you on a fiscal year in
yeah,
October?
it starts on the 1st of January, not October 1.
Okay, so the sheet that we've got is good for next year, then this is what you're
Yes,
gonna
sir,
start off.
2023.
Okay, got it.
So just to let you know, and thank you. What I gave you as far as rationale is what I'm having to pay to keep our people who are trained and capable.
I got you. So this is just your salary worksheet.
Yes, sir. And mine is listed by the month, and theirs is listed by the hour.
Okay, got it.
I spend lots of hours, but it doesn't make any difference. I just literally it's the stuff.
Okay,
I also have given you then, because of what's on the schedule here, the next one is the excuse me. The next listed portion there is for the vaccine. Recent activities, we've had our clinics today. We had our first, and they will be held every 2 weeks of the health fair. It's now called Health Fair 360. And that we have picked out a couple of tentative dates in April to hold the health fair that we had discontinued during COVID. So it's either the 1st or the 15th or the 22nd in April, depending on when we can get everything arranged to get everybody together.
would that be on a weekend or would it be on what?
Most likely be on the weekend, on Saturday.
Yeah, sometime in April.
Yeah, preferably mid-April.
Okay,
Okay. The other thing that I wanted to mention to you, I don't know if any of you attended, Christy Coleman, after I talked to her and begged and pleaded, she put on a livestock emergency care.
you headed up here at lecture disaster.
Right.
lecture.
Right, exactly. Over in Pueblo here on the 18th.
Heard about it.
And she only had a certain number of spaces, so she invited people from each of the regions, 3 people from each of the regions, so that they could then kind of pass the word along, so to speak.
Or were they regions or counties?
Well,
Or
they,
shared, like,
Yeah,
are we
it
in a
was not
shared region?
yeah, it was not a region 15 or something like this, but it was Pueblo, Fremont, ours, Huerfano.
Okay.
And she had put that on several years ago. You guys were all here at that time, but I thought that it needed to be done again, because there's a lot of complexity if you have some kind of a disaster and people have to start shipping their cattle to keep them alive. It's not an easy thing to make sure you get all the people's cattle back to them and stored and fed, and people who tend to make claims that their cattle is the only prize cow in the world. And so, anyway, so it was well received. The infectious disease report. We've had no deaths reported, and remember that those are between 6 months to 2 years out. We've had no deaths reported since May here in our county. This is from the vital statistics section program up there in Colorado and Denver. Monkeypox report, they finally admitted that there's just not enough happening. Here, everything, the incidence has dropped so much that we're not even holding meetings anymore.
Tried to make it look like a pandemic. But
Yes, and it was
fizzled
not.
out.
It was obtaining money to extend the pandemic. Okay, the recent variants, there is a slight rise in incidence, but it's not, this particular variant is not killing people and basically putting very few people in the hospital. Those people that are going in, most of them, even the kids, are people who have other diseases that are weakening them, that are making them more susceptible to having serious results with the lungs. We have had more, even though we have lots of people who are ill, but not seriously ill. It's gone in a few days. Basically, we've had more of the children showing up with the RSV, the respiratory syncytial virus. These are very young children, infants up to 2 years of age. And that is of concern. And so any children who have the disease, we had one teacher who ended up catching it also. We have to have those people stay out of public, because this is a very, very contagious disease.
Quarantine time, 14 days.
Quarantine time.
Is it 14 days?
Yeah, between 10 and 14. So I gave you on this some background information for RSV. It should be in your packets someplace. So if you have anybody that gives you questions from reading this, hopefully you should be able to answer the questions. If they have significant questions, you can always just have them call me. I wanted to mention this for women between 40 and 64 without health insurance. There's a Women's Wellness Connection website, and they can literally go on that site, Women's Wellness Connection website. And that's down there in print also under free mammograms. Because so many women were not being tested, the incidence of breast cancer has increased. So we're trying to get a hold on that, get control on that again. But these are free mammogram sites, so the women can go if they have not been tested and do not have insurance. The vaccine report, I have complete listings. Let me go through just real quickly. In Custer County, we have given 706 to 19 plus, or 20 years old, effectively. For vaccines, we have just for the influenza vaccine as of Friday. So that's 706, and we have for the next several weeks, we're booked solidly. Lots of people coming in, making their appointments and coming in to get their flu influenza vaccine. For private sources, all of those things are broken down under aggregate doses administered by vaccine fund source.
A lot of kids coming in.
Not a lot, but some. Most of them are adults. Be quite honest with you.
Okay.
But like I said, the grand total is 706. Okay, so that's broken down between 327 for the bivalent doses and 378 per foot.
Is that year to date?
I'm sorry.
Is that year to date?
Yes, it is as of last Friday. It doesn't include today, but it does include Friday.
So
You know
they're on
that-
the calendar year then?
Yeah, remember that the flu season doesn't start until about the 1st of October.
Hmm.
Because the vaccine is only particularly effective for about 5 to 6 months. So if you give it to somebody in August, the effectivity is gone before the end of the season, so they can end up getting sick in the spring. When everything else is breaking loose. Okay, so past that, we have no way to measure the testing numbers right now, and I've told you guys this before, because people are just plain not reporting. So even the state is starting to have problems being able to give proper incidence numbers.
So eventually they're gonna get some routine thing here where it's treated like
Yeah,
the
like
other
flu.
flu.
Yeah, any other virus. Yes, sir. So, let's see, what else? We don't have any way to measure. I've already talked about some of the programs that are in progress. And the buses that we have one this Friday, and we'll have another toward the end of December. Just for the record, influenza vaccinations are being given every day throughout the week, not Saturdays and Sundays, but every weekday. And that's done by appointment. And if we have somebody who doesn't show up or cancels or whatever, we always are having people signing up. So we are full. Okay, are
Can I
there,
interrupt just for a second?
please do.
Go ahead.
Look out that window, Will. That's the company that did the mold mitigation over at
Oh, it is?
Rescue, yep.
Got guts coming up there. We need to go talk to him.
No idea why they're here, but
Hmm.
I just happened to look out the window and see that. Were you there when that Restoration One company
Was actually there functioning? No, I was there at the very last, but not while they were in there.
I didn't mean to interrupt, but we had this conversation during the commissioner meeting and I just happened to look up.
There they were.
I don't know what
Our
he was,
run.
who was. Anyway,
Thanks. Okay, where are you now?
I am potentially completed if you wanted, and I showed this to Kevin. This is one of 30 different appendices for our new EPR, emergency preparedness document. Okay, 18 pages long. We're going through everything, rewriting, updating, making it applicable. This was originally written in 2010. And this is our first update. 12 years. So anyway, this is.
Who's all participating in that?
Lee and I are doing the major portion, but we're tag teaming with the Pueblo, the big offices there
Okay.
that have lots of people working for them. So we try to get information from everybody. And I work also with Christy Coleman and with, because so much of my work before coming here was with various types of emergencies. It's pretty easy to draw out from experience.
Okay.
Other than that, gentlemen, I can stop if you have specific questions. I'll try to answer them for you.
Anything, no?
No, not really, just this whole salary thing. Obviously, you're getting ready to make a run at us to get your people more money.
Gee, now, why would you always say a thing like that?
We haven't decided what we're gonna do for salary increase.
Mhm.
Probably won't until next week, or I don't remember what day we were meeting.
You need to submit whatever you've been working with Braden and
Yes, yeah, he has all the documentation.
Okay.
But I
make
just
sure he
want-
understands it.
I don't have a good vehicle to determine it.
Well, give him whatever you got.
Yeah, and we are. And he said he is satisfied so far. with The information. we've
Okay.
given. But I just wanted to give you guys kind of the base. What I'm up against. Trying to keep the people and exercise the programs we have. When the competition right now is, we can't possibly meet, but
So, yeah, so for example, I know you put something in here and you said, baseline for the nurse you had is $39 an hour. Given that a new nurse gets 59. So there's some of this is, you're gonna have to make clear to Braden, so we understand it is. That nurse is willing to work here and not go to work down there because it's saving on the money driving. And plus she wants to hear like the environment, so she's donating something to do that, so. Equivalent amount is X. So we understand, and how it's being paid, and she knows that if it's a grant funded, then it goes away.
sure.
So make that clear to him, because we gotta separate what you're asking the county to fund and what you're asking.
And this big workforce grant that we're functioning under right now. Part of that will expire in July 1. Okay. So it's not October 1, it's July 1
Okay.
when they do their.
And they redo that or whatever,
Yes,
and I know you've been working with, so I know there's. Allowances for the wages to be paid, but that's just the risk they take, and they're willing to do that because they like living here.
And they are willing to do that much for the community. Even though the last nurse I hired said, I've never in my life been paid that little. Said, well, that's a customer.
But it's not that so much as she wants to be here. That's
Yep,
what it
that's
is.
exactly right. They're living here. So they're donating back, but we still have to be able to feed them.
Sure, all right.
You can look at the sheriff's office, you can look at the bridge, you can look at every office in this county. And it's the same situation, and not just in government, but also the private entities.
Yes, sir.
Everybody is hard pressed to find help and keep help.
Yeah,
To
keep
me,
it,
it's not a matter of, we have to be able to find a way to pay them. That's not it. We can only pay them what we can afford. If they don't want to work for us, they go down the road.
and that's right. The grant doesn't fund it, they're
That's
gone.
right.
So I hope we're not setting these employees up for a big fall.
Well, it's not a big fall because they're not getting paid that much.
No, the point is if it goes away.
That's right, exactly. And they know, I've talked to each of them. Let them know if we lose our funding,
It goes down with it, whatever we
Yeah.
get.
we lose. But that's why I'm.
And I'm assuming you need to make sure the other counties are in the same boat. I mean, not everything is funded by the county.
That's right, exactly. None of them are, like, all of us, all the directors fund as much as we can through grants.
Okay.
Well, for example, and I don't want to pick on her, but it's significant. You've taken Rhonda's salary from $25 an hour to $31 an hour in 10 months. Is that correct?
True,
That's $6 an hour increase in less than a year. That is going to be a big fall when everybody else is looking at 80 cents to $1.20 an hour.
I understand she had been grossly underpaid and we cannot afford to lose her, which is why I increased her salary. She had just looking, remember I brought.
That's grant funded.
That's grant funded. And understand that I remember that I brought those things to you and said, this is the bottom. And even with the increase that I gave her, it was less than the bottom across the whole state.
I get it. And part of me says that's all well and good, but it doesn't matter. If we can't afford it, we
don't
can't
have
afford it.
facts, we don't have-
So I'm worried about setting our employees up for the big fall. If those grants go away, which there's a good chance they will eventually, just like the workforce grant, you may lose her anyway. So the threat of losing somebody doesn't work.
Well,
Here's what we're gonna pay. Do you wanna work for us or not? And if they don't, then move on down the road. We can't keep printing money. I don't know where we're gonna come up with that kind of money.
Well, we're not, either that, you don't get anybody at all, and then we don't have a health department. We have to have a health department by law.
Well, I would guess there's people that are willing to work for less than
For
$31 an
$15, I
hour.
don't-
Damn right.
I don't think, I'm not doing what. they're
doing,
doing with the
doing
expertise.
grants. and-
Go get a nurse to do that. Nurse ain't gonna do it.
Oh, I'm not talking about a nurse.
I know,
I'm just saying.
talk about that. I don't know what, you call it.
Yes, grant, yeah,
Grants,
that's,
right.
that's why I gave you the,
Maybe somebody will write grants for $15 an hour, and let's go find one.
yeah,
Well,
it's even the bottom salary for grant writing and for financial management is substantially above.
So what is her
That's
training
throughout the
in finance, man? She a CPA?
Rhonda,
No, I know she's not. I wanna know what she,
She's not a CPA.
or what she meant, how does she
But
just,
she has been doing it for 15 years now. And so she is actually a certified social worker. And then she worked in financial planning and management for large clinic hospital associations prior to coming here.
Yeah. but Tom's point's right. I mean, if grant funding goes away, then it's a $15 an hour, down. Whatever the base. is.
and I think she's salaried as an administrative assistant. Correct?
Except that I brought that to Braden for a
Update, you
description, a
updated her
job
description.
description, a job description of what she's actually doing, not what her old title is. Yeah, because I wanted you to be very, very certain on that.
Has to be clear.
Yeah, I mean, I get it, and I don't mean to be a pain in the ass, but job descriptions and cannot dictate necessarily what the pay is going to be. We can all write up job description to make them worth $60 an hour.
Of course.
Number one,
Well,
what are
that-
they doing? Number two, what can we
That's
afford?
right, only if it matches what they're actually doing. You gotta pay them for what they're doing.
And can we afford it?
Right, and if we can't, then, and if the grant doesn't pick it up, they're gone. That's pretty straightforward.
Everybody's gone. For sure. And I'm not trying to belittle or anything like that. I'm just letting you know there are opportunities to do something else are always there, and right now they're really there for public health.
Well, I think that's part of your job is to make us cognizant of that,
Yeah.
even though we probably already are.
I think so.
I would guess you're probably in absolutely no different boat than law enforcement.
Right.
I mean, it's not unique to public health. I understand that's what you're concerned about. I get that.
Right.
Um,
But
It's hard to get
people have to
anybody.
spend a lot more money,
Especially,
and time getting trained.
well, your nurses do.
Yeah, that's what I'm talking about.
Okay.
Yeah,
So you say your
professionals
people,
do.
Rhonda doesn't spend as much time
That's
getting
right.
trained as a law
That's
enforcement
right.
person.
But
But,
professional,
I think we're-
professionals do.
you know, I get that you have a job to do and I want you to understand we have a job to do. And our job to do may be say, you know what, we're not paying anybody in your office $34 an hour to sit behind the desk. Not because we don't want to, because we can't afford it. That could be the case. And you need to be prepared for that, and your people need to be prepared for that. If $34 an hour is your proposed increase for next year, I will be amazed if the county can afford that.
we can't.
You
You've already
guys
said
have-
that. It only is backed up by a grant. If that's what they agreed to pay, that's the state giving them the salary for it. If it goes away, so does Rhonda.
Or she goes back to $21.
Or
an
she
hour.
stays for whatever we can afford. That's the choice, but that's something that would come in time if it does come to that. It's just, they've got to understand it in spades.
Yeah, the other thing that I keep hoping and planning for and mitigating for is this workforce grant is something that's fairly new. Okay, like they just brought it out here in the last few months. And I think that Michelle Shimamura and others are mitigating for continuings of some kind, because otherwise they're not getting people to come back on. They can.
The only
More
way you'll get
burgers.
people is in the city where they can live and they can afford
Right.
bigger tax base to pay them.
Right.
Otherwise, the counties all of rural counties, and we're all in the same boat, and that's why they have the grant programs until they grow or whatever we
It's
come up
for
with.
rural health. So do I hope that that kind of thing happens? Yes, but I can't plan on it.
Yeah, I wonder if we would be smart in this situation particularly to say, here is your county salary, here's your grant funded
Absolutely,
salary.
so
And
that's
not call it,
That's what I thought we
total-
asked them to do.
not call it a total deal, because we're gonna get hung out. to
I
dry.
agree,
You
I
guys
agree.
know that,
They,
right?
they need to know what the
Minute.
county can
That's what,
afford.
that's been my point.
Well,
for
then
some
let's
time.
get
And that's what
Line on
my,
that.
we all are in agreement. And I thought when we had that budget discussion before, when we said, you do it, if the grant goes away, and if they don't like what the base is, the county base.
Yeah.
But that's not what you're looking at
No,
on
we
this
agree
sheet
to
of
that
paper either.
point.
That's why I say he didn't really
All
do
here is just the total. And I
Yeah,
haven't
so-
broken it down.
So we've got apples in one hand and we're looking at oranges.
And you know where we're gonna get hung out to dry. Any county employee is gonna come to us and say, how in the hell? can
I
we
can't
get
afford it. We're not paying that as the
$34
county.
an hour? Well, it will look like it.
I know, that's why it has to, that's why I'm agreeing with you. He has to present it
Yeah.
so that the county base shows what it is, what it really
County
is.
supported salary and
And-
grants.
And that, and I've used that a lot. I'm gonna have to look at the one when we got, remember when we got wrapped around the axle for collective agreement and we had to make the case. We have about $8 million taxpayer money paying wages, period. The rest of the $7 million that we pay are in grants for not just him, but everybody else that's on the trough, with grants that we pay because of our appetite being higher, whatever the job is. So if those go away, we're back to what the basic services are, and that's plowing roads and,
Well, health should be.
that's my point. There is a basic service. And if the grants doesn't, and the state knows that, and we can't afford any more, if we're gonna get professionals in here. Cause I'm not gonna give shots, Kevin's not gonna give shots, and neither is Tom. And we're not gonna go, taking temperatures and doing the medical stuff or the administrative stuff either, because those are experts that are in that field. So that's what it has to be, and that's why it's important for the county to understand, because they don't. People see a budget and they say, gee, well, I've got taxes I gotta pay, and the roads aren't even getting graded. Well, they don't understand the process. The budgets for the road grading is boxed. It's only what can be there, and they can't compare that with these other things, and they gotta know why and how. So it's up to you to be really clear on how that, if we're gonna have a world-class, state-class level public health agency, here's how we're doing it. So if they know it, and these are the great services. Heck, the health fair, even the health fair, takes experts.
That's a good question. Do we have a health fair coming?
Yeah, I told you right at the beginning.
Yeah.
It's
Okay, I missed that.
360.
Yeah.
Where were you?
Yeah,
They're gonna
right.
rename it.
The middle, we wanted to do it toward the middle of April. Remember that?
Yeah, you're gonna pick a date. We haven't nailed it
Yeah,
down.
it's not nailed down.
So,
We're
excuse
trying
me
to-
for missing that earlier.
No problem at all.
You need to stay hooked up.
Well, you get
buzzed
so
out
bored
over here.
listening to me.
I might have been looking for my documents.
I think that's what I was doing. I was scrolling, but I was listening. All right, got anything else?
We're good.
And work with, there's ways you can make the public aware. You don't have to wait till a budget review. We don't have to wait till all of a sudden we're asking for a tax increase to make public aware. That's why we got, Jennifer here doing her thing. And it's good to point that out in health fairs. That's a neat place to advertise. Here's what they're doing. Here's the great things that public health agencies. And I know that the pandemic helped bring that out, but it was publicity that came with the job of protecting people. It's gonna be harder when they don't understand all these other things, the social impacts, the drug addictions, the pregnancy stuff, all that they don't see in the background.
Yeah, we don't have here, at least to my way of thinking, we don't have here an easy way to get an effective way to get a lot of this information out. People's eyes kind of glaze over.
That's right. That people don't understand what a public health agency does, actually. in the state.
Yeah, a lot of it's behind and it's preventive. When you are in desperate straits because people are dying, that's
Then you're
very
reacting.
public.
but,
Then you're active, it's not public health
That's
at
right.
that time.
Well, your job is to keep them spending the money on crap, on really emergency stuff. Okay,
So I think Bill asked you about your totals for your expenses, budget expenses for 2023. Do you have a rough estimate of that?
I don't have that here in front of me, Tom.
Okay,
That'd be good to know, and you know, that's a great thing to have, because that, what if it's $1 million? $1 million worth of stuff is being done in this county for the good of the citizens, it's not for the good of me or you or the nurses. So that's important to have, or if it's $50, then we're really shy of serving our people.
And Rhonda has provided those things to Brayden, and I will,
All right,
I'll get that breakdown for you guys.
Good.
Send it up. Anything else, gentlemen?
I'm good,
well, I'm good.
Kevin.
Good here.
So that's it, no new business to do anything.
Not for now.
Any public health, or comments? Is anybody listening online, or are we by ourselves?
We have a couple of people, but nobody's raising their hand.
Okay, then, it's, 2:15. I adjourn this meeting. Good job. I know part of it, you just gotta figure a good way of presenting. Dr. Brown, you.
Yeah, well, I will get together
We'll
with
see on
Jennifer and
budget
see if
time.
we can get some